Lumbar spinal fusion is a technique whereby we will trick the bones of the spine to think that they are broken and need to fuse together. Now we'll do this by roughing up some of the bone edges and applying rods and screws for added stability, as well as bone graft, both from the patient as well as cadaver, to aid in the process of getting those two bones to grow together. The benefits to patients who have lumbar spinal fusion, if chosen appropriately, is that they can get fairly rapid relief of both their leg symptoms as well as their back pain. And unlike some of the other non-operative treatment measures, it can lead to a more permanent fix at that fusion level. The decision to perform lumbar spinal fusion surgery rests on a number of factors. Most importantly, the patient has to have the appropriate indication for a spinal surgery, and that being either spinal instability or a large spinal curve or scoliosis. But then prior to even considering that spinal surgery, they need to have exhausted all non-operative treatments, including physical therapy, weight loss, interventional techniques such as epidural injections. And then if they fail those treatments and the pain is still significantly inhibiting their quality of life, only at that point do we then discuss surgical options to treat their disease. After surgery, I will limit patients' movements for 3 months, and I ask them to avoid the extremes of bending and lifting and twisting. Now, I know you can't live your life without doing those things, but it's really just more of a reminder that, hey, if I drop a pin on the ground, maybe I don't bend over at the waist to pick it up, or I don't try to look behind me or twist the whole way. But you can twist enough to perform personal hygiene, but it's really just a reminder to try not to do too much in that initial post-operative period. Physical therapy is involved at the very initial phases in the hospital to ensure that patients are in fact safe to go home. But the physical therapy that most people think about, where we're talking about strengthening of the core and that sort of thing, doesn't occur until 3 months after our surgery, after we've allowed the body to heal and hopefully the cells in that fusion area on the pathway to forming bone. The advice that I would offer any patient who is undergoing lumbar spinal fusion surgery or any spine surgery in general is that they need to have felt that they have exhausted all of the non-operative treatment options, and that the symptoms that they are having are really inhibiting their quality of life and the things that they enjoy doing. And it's at that point then I think that you can have an understanding and take on the risk involved with any surgery on the spine.